Good morning to all the staff of the University of the Free State. I'm Dr. Sabia Valda, and I'm a senior lecturer as well as a pathologist in the Division of Virology with the School of Pathology.
Good morning, I'm Susan van Jaarsveld from the Human Resources Department.
Okay, so the entire reason for our live stream today is that, well, everybody has heard about the new coronavirus, and there seems to be a lot of concerns and issues regarding this. So we thought we'll have this live stream where we can answer and respond to some of the questions as best as we can.
Okay, let's keep on sending the questions to covid19@ufs.ac or type the questions on live stream, and as soon as we receive it, we will answer the questions.
Okay, so let's look first at this whole COVID-19 outbreak. So I think we all are aware the virus itself started showing symptoms in patients in China towards the end of December last year, so that's 2019. And by the end of the year, beginning of 2020 was when the virus was actually discovered. So it has a proper name now. The name of the virus is SARS-CoV-2, and the disease it causes is COVID-19. So a lot of people want to know, where does the 19 come from? And it's simply 2019. That's what it stands for. So SARS-CoV-2 started off in China, but according to the latest WHO reports, it's spread throughout the world, and there's now more than 200,000 cases globally, and we're closing in at close to 9,000 deaths around the world. So South Africa has had their first lab-confirmed case on the 5th of March this year, and as at yesterday, we had 150 confirmed cases, no deaths yet. So there's a lot of concerns about the whole outbreak, what we should do, how should we react, and hopefully this Q&A session that we're going to have in a few minutes will answer a lot of those questions.
Okay, we will also look now at the mechanisms that the university has put in place for its students and staff to minimize the risk for the virus. At the beginning of this week, the extended senior leadership group had a meeting, and a decision was made that all academic activities were suspended. Students were requested to remove or evacuate the residences and not later than today, and even the off-campus students were also recommended to go home. A decision was also made that academic staff members must work from home, and they must ensure that the learning material for the modules that they are responsible for are finalized and that it is submitted on the online platform so that students can have access to the learning material. Academic staff members are also allowed to work from home, and normal working hours will be applicable. For the support staff, there are two categories. The one category is for support staff that are office bound. The line managers were requested to allow staff members that where it's practical possible that they can work from home, and this is based on the institutional needs as well as personal circumstances from these staff members. They were also requested to minimize the staff members at office, and that only a third of staff members must be on campus. The second category, this is the staff service workers that are not office bound, and that includes staff from protection services, cleaning, maintenance and sport. And the plan that was put in place there is that those workers will work for 1 week in the cycle, and this implies that they will work 1 week and 2 weeks they will be at home. So that is in short what we've put in place, and also important is that staff members must be available during office hours, and they can be called back if needed when the university or their staff member or other staff members need their work at office.
Thank you very much, Suzanne, for that important update. So I think it's time then for the exciting part, which is the questions and answers.
All right, so one of our questions is, where can one test oneself, and can I go to COFC Health for testing as a precautionary measure?
Okay, so I think that's a rather important question because everybody seems to be concerned about where can I test and how can I test. So yes, testing is available in the South African situation. Up until now, it was restricted to being done at the National Institute for Communicable Diseases, which is known as the NICD. However, it's now extended to other provinces, and the Free State will also be in a position soon to provide testing. The important thing, though, is that the testing at the moment is restricted to a very select group of individuals. So there's a proper sort of a case definition that you need to meet before you actually qualify for testing. I'm just going to go through the case definition very briefly, but it is available if you want to check out the details on the NICD website. And the case definition means that you have to have respiratory symptoms, so you need to be sick with respiratory disease, and you need to have traveled to an area where there's local transmission of the coronavirus disease, or you need to have been in contact with somebody who is a confirmed or probable case of the disease, or you're a healthcare worker and you dealt with somebody with coronavirus disease. And the last one is that if you've been admitted with a severe pneumonia and we actually don't know the cause. So very, very particularly strict case definition as such. And I think a lot of people feel, well, it's unfair. We want to know, do I have it or not? And the reality is that we feel that if we test everybody who's asymptomatic, we're just going to overwhelm the laboratory services, and then in actual fact we won't have tests available for those who actually need it. So for now, only if you meet the case definition, then you can be tested for COVID-19. So it's not sort of a readily available test at COFC Health or anything like that, but if you do suspect that you may have contracted it, the idea is to telephonically contact either COFC Health or your local GP and discuss with them further, so they can advise you on whether you actually need to have testing done or not.
Another question from a viewer. The country needs all hands on deck. Will the UFS introduce screening and testing for COVID-19? If so, when? And if not, why?
So I think that's partly sort of addressed in sort of the testing question that I answered earlier. Regarding screening, so screening is sort of in the form of monitoring temperatures and checking if people actually have a fever as such. I don't think that it's something feasible for the university to actually implement. I don't see how we would actually do that. I think the onus is on the individual themselves to judge for yourself if you are ill, and if you do, if you have had some travel history or been in contact with somebody who is ill, then I think it's up to you to contact a healthcare facility. But I don't think it would be feasible for the university to introduce sort of broad screening as such.
Another question. They say prevention is better than cure. Is it advisable for people to, without suspecting a thing, go and test instead of waiting for symptoms to show first?
No, so I think that's already also been answered with the first question. Testing at the moment is for symptomatic people only.
All right, the next question relates to duration. What will happen if no cure is found by the 14th of April, and what impact will this have on our academics?
Okay, so we're definitely not going to have a cure by the 14th of April. This is, so this outbreak itself is something, it's new, it's on a global situation, it's something like we've never seen before, dealt with before, and it's an evolving situation. We are in it at the moment, so there's no saying how it's going to go. With regards to sort of cure and vaccines, things like that, it's going to take minimum 12 to 18 months. So I think the whole idea is that we need to just monitor the situation, and the university will always keep the safety of the staff and students as their priority. So all decisions will be based on the situation closer towards the time.
What measures will the institution take to ensure the safety of students from possible infections within the campus upon their return from different provinces and regions?
Okay, so that's a similar situation. It's an evolving situation. The university will be monitoring the situation and will give feedback and advice closer towards the time. It all depends on whether we're seeing many more cases or whether it's all just being fully controlled.
Can I add there? And I think maybe I can also mention that the senior leadership group also agreed that the situation will be assessed closer to the 10th of April, so that we will place the necessary measurements in place to ensure the safety of students and staff.
Our next question relates to graduation. What does this mean for students who were due to graduate in April? Does this mean that they will never get the opportunity to walk down the stage with pride for their hard-earned work? So the response to this is, at present we cannot confirm a date for graduation. We are still hoping to host the graduation ceremonies in 2020 and will continue to evaluate the situation in light of the global and national developments related to COVID-19. We do know that students are disappointed, but we thank students and family and friends for the solidarity during this very difficult time. But further information on graduation ceremonies will be available on our official communication channels, as well as the ufs.ac.za/coronavirus on the website. The next question relates to pregnancy. There seems to be no mention of pregnant women during the spread of the virus. Are pregnant women more vulnerable? Is the fetus safe if a woman is tested positive?
Okay, so we do know overall, when a woman is pregnant, because of the physiological factors and the immunological changes that occur in her body, she is at a higher risk of infection and of severe disease with certain infectious agents, for example, flu. So if a pregnant woman has flu, she's at a higher risk of having more severe illness, she's at a higher risk of possible death as well. The coronavirus, it's brand new. From the few cases that have been described so far, it doesn't seem that pregnant women have had more severe disease or have been particularly likely to be one of the case fatalities. But again, we simply don't know. It's an evolving situation. It's something that we need to look out for. So for now, pregnant women can be considered to be sort of in a high risk group, similar to the elderly and those with comorbid conditions. Regarding the fetus, so we have information from the SARS coronavirus, the one from 2002, and there was no sort of evidence of vertical transmission and congenital abnormalities in the babies that were born. So with the information that we have up until now, it's similar for COVID-19. But again, we simply don't know. So yes, pregnant women are considered as a high-risk group, but we actually don't have information yet about possible congenital abnormalities.
So another question, please talk about how we can calm out anxiety, and do people that die smother to death, or is it painless?
Okay, so to calm out anxiety, I think that's a rather difficult question for me to answer. It all depends on each individual themselves. But I think the best would be to educate yourself and keep abreast of the situation. I mean, if you know things, then you're obviously going to feel a bit more in control. There's a lot of excellent resources available. The university page has resources on COVID-19. The NICD page, the WHO for the global situation, it tells you about what you need to know, the current stats, things like protecting yourself, and issues like that. So I think that would be the best. With regards to the question about the feelings at death, I wouldn't know how to describe that. I guess it depends on each individual and their situation at that time.
Can I also add with the wellness of staff members, if they feel overwhelmed, they can also call or make use of the service of Careways, and all of them have the contact details, or they can even visit the HR department's website or Careways website for additional information or the contact details.
All right, another question. Is it necessary to cover your mouth and nose with the mask and wear gloves?
So no, the short answer is no. Okay, so I think the issue about masks is that we've all seen the pictures from China and everywhere else, and everybody's got a mask on, and you think this should be the primary response. But actually a mask is not intended to protect you from coronavirus disease. The whole way that you can actually protect yourself, or the best way that you can protect yourself, is to actually stay away from people who are ill. So you want to keep that distance away. If you yourself are coughing or sneezing, then you need to practice the proper etiquette, so you sneeze or cough into your elbow. Ideally, you can use a tissue and throw that away immediately, and then the focus is on hand hygiene. So the idea is that the virus itself, it's got an envelope around it, so it's actually quite labile. In other words, you can get rid of it just by using soap and water or hand sanitizer if that's available. So the idea is hand hygiene, hand hygiene. Hand hygiene to avoid touching your face, and that's easier said than done, but to avoid touching your face because there's a possibility that somebody spread their droplets onto a surface or onto some item and you touched it, and now you touch your mouth or your nose or your eyes and you introduce the virus by that source. A mask is useful if the individual themselves is coughing and sneezing and has like a runny nose and things, because then it protects everybody else. But the mask is not meant to protect you from getting infection. In the healthcare setting, it's different because there's special masks that healthcare workers can use to protect them from getting infections. And ideally, we want to reserve those for the healthcare staff. They're already in short supply, so we want to reserve it for those that are actually on the front line of the situation. The other issue with the masks is that the WHO has recommended that it shouldn't be used because if you don't know how to use it properly, you're actually going to infect yourself. Because you can imagine you're wearing a mask, but it's actually not one mask forever. You have to change it. You have to discard it properly. And if you're going to handle it from the front, you can inadvertently then self-inoculate the virus into yourself, perhaps, because you're going to touch the mask and take it out and then rub your eyes or your nose, and then you can introduce the virus that way. So it's actually not recommended for asymptomatic people at all.
All right, another question. How effective are hand sanitizers? And please explain exactly which bacteria do they deal with? The ones before I sanitize the hands or the ones I encounter after sanitizing the hands? How often should I sanitize hands, and how long does it stay effective in the hands?
Okay, so hand sanitizers are effective. They obviously won't sort of kill off every single living organism because they all have sort of different characteristics. So in certain instances, I mean, hand sanitizer will not kill off certain bugs, and you actually just need that physical soap and water, right? The hand sanitizer that you use should ideally be one that has 60% alcohol in it, because that's known to kill off the viruses, all the viruses that have an envelope around them. So they definitely will die off with that. The idea of the hand sanitizer is that you use it frequently throughout the day. So after doing common things, after touching surfaces, door handles, anything like that. So after there's no like you need to do it 10 times a day or something like that. It's after you commonly touch surfaces or interact with people. The idea of wearing gloves was asked in the previous question, and I think I forgot to answer that, and that also doesn't help because it's not like a protection that you put on and now you're safe for the rest of the day. You still have to practice hand hygiene. So hand sanitizers, in a similar way, you need to use them sort of, it's like after the interaction. It's not going to be like a shield to protect you for the rest of the day. So it's like after I've touched the desk and stuff, I may want to just go sanitize my hands quickly, something like that.
Can you suggest any homemade alternatives to branded sanitizers? And as many sanitizers have disappeared off the retailer shelves due to panic buying.
Okay, so there's a lot of questions about how can we make our own hand sanitizer, because it really is in shortage. The answer is yes. There is a lot of sort of recipes that you can follow to make hand sanitizer, but the baseline ingredient is 60% rubbing alcohol, which in itself is in shortage. So the short answer is that no, you shouldn't be trying to attempt making your own hand sanitizer at home. There's no hand sanitizer, soap and water. I mean, any soap. So that's the idea. Everybody has access to soap. So just normal soap and water will be fine.
All right, another question. When is the coronavirus contagious?
So the coronavirus is spread by respiratory droplets. And while we do produce respiratory droplets normally when we talking and laughing and things like that, majority of the droplets are produced when you sneeze or you cough. So the virus is considered to be contagious when you are actually symptomatic. There has been queries about asymptomatic transmission, but that's still under investigation. So for now, the primary means of transmitting coronavirus is through droplets that are produced when you're coughing and sneezing when you are ill.
All right, another question. How can we prepare ourselves when we all eventually contract the virus? And what medicine should we have at home?
Okay, so I'm not sure, but if everybody has actually listened into or watched, yesterday the health minister was actually addressing a whole group of doctors, and what he did say is that, I mean, this is a respiratory virus. As humans, we sort of social beings as such, and we're very poor at hand hygiene. So it's probably going to spread, and it's postulated that sort of 60-70% of our population will be infected with the virus. The good news is that 80% of those that are infected, as long as you're young and healthy, you're actually going to have very mild illness. And it's just a smaller percentage, so 20% of people that we're looking at that will develop severe disease and hospitalization. And a smaller percentage from there may then eventually die from this. So this is not a virus that as soon as you get it, you're going to die. No, it's not like that. In terms of, what was the second part of the question?
What medicine should we have at home?
So medicine-wise, it's brand new. We have no cure for it. As I said, there's nothing specific that you can take that can prevent you from getting the virus, and nothing specific to treat it once you get it. So once you do get the virus and it's confirmed, the mode of treatment is symptomatic. So you'd be treated with something for your fever and your muscle pains. You may be given antibiotics if you develop a secondary bacterial infection. But because this is a virus, you're not going to primarily get antibiotics as treatment. So for now, it all boils down to hand hygiene, cough etiquette, social distancing.
All right, another question. Is the university going to temperature screen students, personnel, and visitors entering campus?
No, so I think I've also answered that question previously. I don't think it would be feasible at this point.
Another question. How do I approach a very strict manager if he wants me to come in for a meeting in a high-risk area such as the hospital?
I think it's also a challenging question, but what I can tell staff members that if they are having trouble with a strict line manager, they can contact the HR department. The contact details of all the HR staff members were made available, and then you can contact the HR department and they will try to assist you and make sure that everybody is really accommodated based on the institutional needs as well as on a humane manner for each and every staff member.
Are staff members working from home during this time expected to work from their place of residence while employed by the university that's within the region of the campus they work at? For example, if you work at Bloemfontein campus, are you expected to work from your residence within the Bloemfontein region?
Okay. I think we already also sent communication out in that regard, and it was indicated that you have to work from home. The reason for that is because you must be available, and if you are needed at the campus, that you will be available in a short time of reasonable time to come to the campus. So, and that's also in line with what the President Ramaphosa indicated, that we have to limit our travel during this time. So we also ask people to work from home or from the office and not from another place.
The next question relates to why is the availability of hand sanitizers only in the main building and not in other buildings on the campus?
Okay, at this stage there is a challenge, and I think part of this question was already answered. There is a shortage of sanitizer, not only in Bloemfontein, but I think in the whole country. And the university already ordered hand sanitizer as well as soap. And as soon as the university receives it, especially the soap and water will be made available to all the other offices. But at this stage it is a challenge, and if you look at the visitors, that's the reason why the hand sanitizer was put at the main building. Lots of external people are visiting the main building, and that was also one of the mechanisms that we've put in place to minimize the risk of the virus.
Thank you. The next question, how will the disease affect people who have asthma?
So any person who has any comorbid condition, So if you've got asthma, or if you've got cardiovascular disease, or if you've got diabetes, then you're in a higher risk group, similar to the whole pregnancy group. You are at a higher risk of more severe disease. So definitely that group of people, or those risk groups, are the groups of people that we actually want to protect. So while 80% of us are all going to be fine, we want to protect those 20% that actually have comorbid conditions and are at a higher risk for severe disease. So they are at risk for more severe symptoms.
All right. The next question relates to at risk at work. If I was exposed to a company 10 days before the news broke for a period of 4 days, would I have to be tested? Should I take the necessary precautions?
Exposed to a company.
If a person is exposed to a company 10 days before the news of the virus broke and a person was exposed for 4 days.
I'm actually not so sure what that means, like exposed to a company. But I think if you've traveled in the previous 14 days, or if you've been in contact with somebody who is a confirmed or probable case of COVID-19, and you now have symptoms, then you need to contact your healthcare provider for possible testing. But asymptomatic, as I've mentioned before, you don't exactly qualify for testing at the moment.
Okay, the next question. My son falls in the high-risk group. He does not show any symptoms of any illness, even fever, until it has escalated. He has been placed in isolation, but not me. I still work on campus. Does this mean that even though my son is asymptomatic, I will not contract the virus?
If your son is asymptomatic, so if your son is already in isolation, then that means that you wouldn't be having any contact with him either. So the idea is to protect the son from actually getting the virus. So I think you should just continue sort of with your keeping away from him, and then your normal preventive measures like hand hygiene and things like that. If your son is confirmed, then obviously that sort of changes the dimensions a bit. But if it's just been as a precautionary measure, kept in isolation, then I don't see him as being a risk factor for you. But I'm not sure whether I understood that question well.
All right, the next question refers to exposure. Am I at risk if I was recently exposed to individuals in a school who has been tested positive for the virus?
So it depends on what your interaction was with the individual or individuals who were tested positive. So again, it boils down to sort of the case definition, and it involves close contact. And close contact means if you've been in contact with the person, so sort of within a meter of that person while they're coughing and sneezing, or if they happen to cough or sneeze directly on you. If you've been in contact or talking face to face with the person for more than 15 minutes, then that would be considered a close contact. Any other sort of distant interaction, just being around in the same area, it doesn't particularly put you at risk. But I think if you're concerned, it's best to contact your healthcare worker for more advice.
Another question. If the virus affects upper respiratory section, can one not be given broad spectrum antibiotic in combination with antiviral agents, and why?
Okay, so antibiotics, as I said, not primarily going to work against the virus because it's a virus and antibiotics fight against bacteria. Antivirals, we actually don't have any antivirals that are registered and approved for coronaviruses as such. So there's nothing that we can use. We don't, there's investigational sort of broad spectrum antivirals that are being tested out, but obviously we can't use these things before we know that they do work. So no, it's symptomatic treatment. We're not going to use any broad spectrum antiviral or antibiotic just routinely.
The next question relates to graduation again. Will it be possible to have our degrees sent to us via courier, or have them collected and then cross the stage at a later stage when we recover from the virus? All right, so certificates cannot be issued prior to the conferral. Graduates will, however, be able to obtain their academic record together with a confirmation letter, confirming that the qualification has been obtained. Next question. What exactly is the university's plan to make certain that we do not fall behind with our scheduled work?
That's, I think I already answered that question, and academics and even support staff, it's business as usual. It's only that they will have to work from home, and all the learning material will be available on the online platform, and I think even for the postgrads, they will be contacted by maybe their study leader and some of their lecturers. So I think there is certain mechanisms put in place, and the online platform will make provision that they will not fall behind with their academic work.
Another question. Is the university still going to pay the cleaning staff and maintenance staff?
Yes, it was agreed because, as I already indicated, it's business as usual. So it will be expected from all staff to work, and those that, especially in the second category of people, that we will only allow them for 1 week, for the 3-week cycle on campus, but they will still get paid even if they are not on campus.
Another question relating to self-quarantine. How does one go about self-quarantine, and when, especially if one lives with another person or a family member that's been diagnosed with the virus?
Okay, so just to maybe take a step back, there's sort of, I would say, 3 different categories. So you get social distancing. So that involves something that everybody could do, and that is why that is sort of the reason why, like, schools and stuff have been closed, why the university has actually sent everybody home from the university and closed. So that's social distancing. You want to avoid large crowds of people being together because you can have a potential spread of the infectious agent. So that's social distancing. Quarantine is where you have a person who has no symptoms but was exposed to a probable case or a confirmed case, and you want to now separate that asymptomatic person from other healthy individuals. And then you get isolation, and isolation means you now have symptoms and you are confirmed to have the virus, and now we want to separate you from other healthy individuals. So there's 3 different things that we just need to get sort of clear in our minds. The self-quarantine process has been identified as a way of potentially reducing the spread, and according to the NICD website, they do recommend it for travelers returning from medium and high-risk countries that are asymptomatic. So it's a means of, they have potentially been exposed, so this is a way of keeping them away from everybody else who hasn't. The whole quarantine process it should be like a controlled process. It means staying within your own home, not going out, not going for shopping or anything like that. So minimal interaction, no interaction at all. It involves monitoring for symptoms, so checking temperature on a daily basis, and it involves immediately contacting a healthcare facility as soon as you feel that you are developing symptoms. So that's the whole quarantine process. Obviously, within a home, it's a bit more tricky or difficult as such because you're living with other people, but the idea then would be to sort of remain within your own room, preferably use your own bathroom, and try and keep 1 meter to 2 meters away from everybody else in the house. If you've used dishes, you wash them immediately, things like that. But it can be quite tricky to manage within a household.
The next question relates to staff. What provision is made for essential services staff who have children at home but do not have enough leave to use for the time that the schools are on holiday or are closed?
I think I already indicated that people do not have to apply for leave. If their work allows it, they can stay at home and look after their children, and there is a work plan put in place so that everybody will be accommodated, so it's not necessary for them to apply for leave, and they can look after their children. And it is also on a rotation basis, so it is possible that they will be able to look after their children. So it is not that we start with a childcare at the university, but staff members will be allowed to look after their children in a reasonable way.
Next question. How safe is it for customers to be served and assisted with patrons wearing gloves, especially if the gloves are used for an extended period of time?
I don't agree with people wearing gloves as such. I think hand hygiene, so as in washing your hands with soap and water, or using a sanitizer if it's available, is the way to actually prevent infection. And definitely the risk of putting on gloves at the beginning of a shift or in the beginning of the morning, and then carrying on with that, touching everything, I think it's quite risky behavior as such. Once you've put on gloves, you're probably less likely to, sanitize them or wash them. So I don't agree with the wearing of gloves as prevention. I think companies and shops and stuff should rather focus on hand hygiene. So frequent hand washing. I know some institutions have actually sort of, it's sort of like a thumbs up thing, but they decided on like every hour there's a gong and everybody must go wash their hands. So it's just like a reminder. But I think that something like that would be more effective than actually putting on gloves and not using them properly.
All right, the next question. SARS-CoV-2 is zoonotic. Is there any evidence suggesting that this is spread through domestic animals? And what is the difference between SARS-CoV-2 and COVID-19?
Okay, so I'll start with the last part first. I think I explained that in my introduction. SARS-CoV-2 is the name of the virus, and COVID-19 is the disease. So it stands for coronavirus disease 19. So it's similar to like how you get HIV causing AIDS. HIV is the virus and AIDS is the disease. So SARS-CoV-2 is the virus and COVID-19 is the disease. Yes, it is postulated that it's of a zoonotic origin. In other words, you have a coronavirus that's normally infecting animals, and now it's crossed the species barrier, it's evolved itself so that it can now infect humans, and it can now spread from one human to another. It's thought to have originated from bat coronaviruses. There's obviously some animal that's involved between the bat and the human. We don't know what it is yet. There is some evidence that the pangolin, which is these scaly creatures, they may be involved as the intermediate host, but it's still being investigated, so we don't know for sure. With regards to domestic animals, I've seen some reports where I think some dogs have tested positive in Hong Kong, if I'm not mistaken. But the animals are perfectly well, and I think the latest WHO recommendation is that you actually don't get it from your domestic animals. But again, this is an evolving situation, so we'll have to see. For now, it's not spread from domestic animals. It's a bat virus, but we don't know what the intermediate animal source is. And at the moment, all the cases are human-to-human transmission as such.
Another question. If you test negative but later you might be exposed, do you test again or just self-isolate? As cases are increasing, can we get the virus again even after recovering?
Okay, so that's also like one of the reasons why we're against asymptomatic testing, because when you are exposed and you do meet the case definition, you're probably going to need testing at that point. So having a negative test is not like I'm negative, so now I'm protected and I'm safe. It doesn't actually mean that. It just means that you currently are not infected. The second part of the question was?
Can we get the virus again even after recovering?
From the information that's available thus far, from the numbers of cases that have been seen, it seems as though you do develop immunity against it. So you shouldn't have a reinfection. How long the immunity lasts, obviously we don't know that yet, but it's unlikely, or it's actually not really possible that you are reinfected with this virus.
Next question. What does it mean when people have recovered from the virus when there is no cure?
Okay, so as I said, majority of the people who get infected are going to have mild symptoms. So they have the virus, they get their few symptoms, maybe a fever and a cough, something like that, a bit of a sore throat, and within a few days they're better and their test is negative, so they've cleared the virus, and that's about it. That's what it means. They've recovered. The cure part is for those that are severely ill. We actually don't have anything specific to treat them with, so we can only treat symptoms at this point.
Another question, should healthcare workers stay at home if protective wear is not available?
That I think is a tricky question. There is an issue with the availability of personal protective equipment, and I think we need to make do with the best that we can with what is available. Obviously, we don't want healthcare workers falling ill in mass, because that's going to cripple our healthcare system in itself. But I think this is something that needs to be discussed facility by facility, and see how best to use the limited resources that are available wisely as such. But I don't think everybody can make that individual decision that I refuse to go to work because there isn't PPE. It's something that needs to be discussed before the situation gets sort of out of hand.
Is the virus only airborne?
So it's not particularly airborne, it's droplet spread. So there's a difference when you speak about droplets and you speak about airborne. Droplets means bigger particles that are produced, and those travel for a short distance, like a meter or less than a meter, and they tend to fall to the ground or the surface or whatever's in front of you. Airborne, on the other hand, means that they're much smaller particles. So because they're so tiny, they're lighter in weight, and then they can remain in the air as such. So that if somebody happens to cough and it's an airborne virus, it's going to stay in the air if the rooms and the doors and windows are closed. And if somebody comes in a few hours later, they can potentially inhale it. The droplet one is different because it's going to fall to the surface within a short space of time. So it can only travel maximum a meter, and it's going to fall to the surface. So at the moment, the virus is not considered to be airborne. It's considered to be spread by droplets.
Another question. The US CDC has admitted that they have COVID-19 in their flu. Do you know what this means?
I don't know what that would mean. I'm not so sure what that actually means, and I haven't seen any sort of communication from there. I don't know whether you actually mean that sort of the flu season and the COVID-19 spread is sort of overlapping, which is true because the northern hemisphere is in their winter season at the moment, so it's their peak flu season. So yes, they have circulation of the flu at the same time, as well as cases of COVID-19.
Another question, how will the university handle the effects of information overload, given so far that the radio, social media, health department, World Health Organization, NICD, etc. have published?
I think the university has sort of done its bit in trying to make easily accessible the information that you actually need to know. So basic things and basic videos that everybody needs to see has been provided on the university web pages. Yes, there is an information overload. We're living in this age of social media. Things are spread easily, but I think it's up to you to sort of know where to find the reliable information and to actually read what you want to read and what you need to know. I don't know how the university can actually control that for everybody.
Yes, I can add there, and I think it was also communicated to all staff members that they actually must only visit the university's website for information, and not all different platforms. So I think if you visit the university's website, because all those information are obtained from the NCID, and that's actually the true facts, and we will rather recommend that you only use the university's website for additional information or even information.
Another question. Does one need to worry if one has come into contact with a person who was also in contact with a positively tested person?
So the situation is evolving, and as we get more as we get more cases of local transmission, in other words, the first few cases in South Africa were people who had traveled overseas and come back, and so essentially they got it overseas and they brought it here. But as we get more cases of person-to-person transmission within South Africa, this could be a potential risk. It depends on what type of exposure you had. Again, it boils down to the case definition and the whole idea of what a close contact encompasses, and whether you actually have symptoms or not.
There has been a lot of mention about how the droplets survive in certain weather. How true is this, and how long can the infected droplets survive in the air?
Okay, so yes, the droplets can, so the virus is labile because it has an envelope, but yes, it does survive on certain surfaces for different amounts of time. There's been investigational studies done, but again, very sort of laboratory based, so very controlled environments with regards to temperature and things like that. And they found that the droplets can have viable virus in it for a differing amount of time depending on what the surface is. So it differs for like plastic or cardboard or steel or copper. And which is why we actually say, together with the hand hygiene, there should be frequent disinfection of commonly used sites or commonly handled sites. The time that it lasts is anything from a few hours up until sort of 3 days has been mentioned, and that is without disinfecting. So if you've disinfected the surface, it should be fine.
Is the university busy with a possible vaccine to cure COVID-19? And have antiretrovirals really been proven helpful to prevent or lessen the symptoms of COVID-19?
As far as I know at the moment, the university is not involved yet in any coronavirus vaccine development. This may change, I'm not sure about that. I don't have information about that. Antiretrovirals, anti-malaria agents, there's been lots of drugs that have been postulated to work. So they've been tested like in a lab setting, and they've been found to be potentially useful. They have been tried out in some cases, but as far as I know, the antiretrovirals have not been shown to have an effect on the cause of the disease or the mortality or anything as yet. So it seems like unlikely that it's actually going to be repurposed for use for the SARS-CoV-2. But again, evolving situation, so we'll have to see whether there's some new antiviral that's developed or some other drug that can be repurposed.
Does waiting until you are symptomatic run the risk of infecting your families by waiting until symptoms show?
So no, because again, if it's when you're symptomatic that you're actually coughing and sneezing and things, and that's when you're producing the most amount of droplets. So ideally you shouldn't be infecting others while you're totally asymptomatic. So I don't think that should be a problem. But I mean, we all know in sort of these general preventative measures and the social distancing, while we're asymptomatic, we still shouldn't be shaking hands and hugging each other and being in very close contact with people for prolonged time. So those are sort of general measures that we can have. But at the moment, asymptomatic spread is not something that's documented or proven as such.
Another question, how can a psoriatic patient protect himself from COVID-19?
How can it?
Psoriatic, I suppose the patient has psoriasis. Yeah.
Again, it's the basic preventative measures, staying away from others that are ill, hand hygiene, practicing cough and sneeze etiquette. It's essentially that, avoiding the whole social distancing thing, avoiding large crowds, avoiding going to busy places like malls and things like that as well. But there's nothing sort of specific that you could take as such to prevent it. It's just the general preventative measures and keeping away from ill people.
Another question, will students get funds to access Blackboard from their current abodes?
It will be a challenge, but as far as I'm aware, that if you're going to would like to get access to some of the Blackboard or even some of the other UFS systems, there will be a zero rate. So actually when you're here or when you're not here, It will not require from you for additional funds, but unfortunately at this stage, students will not receive an allowance to buy data to get access to any other platforms.
How is the university going to ensure that people working from home have data and laptops?
Most of the staff members that will be required to work from home, they already have laptops, and some of them already receive data allowance. The people that do not have access to a laptop or data, they will be required to work from office, and if it's needed that they will have to work from home, it was already communicated to line managers that staff members will be reimbursed for expenses made when they have to buy data. Also important, they will have to provide us with evidence that the data was used for work purposes and not for private purposes.
Okay, and our last question. How can one distinguish between the virus and allergy symptoms?
That's a bit of a difficult one as well. So we know that the virus itself, so SARS-CoV-2, causes a wide range of symptoms. It's respiratory symptoms. It ranges from very mild symptoms to severe symptoms. And I think, so you could have a cough, you could have fever, a sore throat, chills, muscle pains. There's often, a whole lot of overlap with the allergies that's quite prominent at this time of the year. And I think it all boils down to, if you know you're allergic and you generally have these symptoms quite often or on a yearly basis, then you'd actually know what it feels like. But I think it all boils down to your exposure. So have you traveled in the past 14 days to an area with local transmission, or have you been exposed to somebody with coronavirus disease? I think you need to sort of weigh it down that way. But again, if you're concerned and if you're anxious and unsure, it would be best to actually telephonically contact COFC Health or your local medical practitioner for advice. Okay, so I think that's the end of this Q&A session, and I hope it was helpful. So we tried our best. Obviously, there were some questions that I wasn't too clear on, but the university webpage is www.ufs.ac.za/coronaviruses, and you'd find all the information there, all the contact numbers. So there's a hotline number. The UFS Health and Wellness Center number is also there. So feel free to make yourself familiar and contact somebody if you actually are anxious and need assistance. Thank you.